This peripheral blood film is from a patient with myelofibrosis who attended the hematology clinic. As can be seen, there is marked anisopoikilocytosis with polychromasia, and also some immature cells like the blast cell seen. The platelets also vary in size, with some large platelets present. Abnormal hematopoietic cells in the bone marrow release cytokines, causing the marrow environment to replace normal tissue with fibrotic connective tissue. This initially results in cytopenias or a reduction in the number of cells. The marrow then compensates by releasing more and more immature cells. The large number of teardrop poikilocytes that can be seen on this film is due to the red cells being misshapen as they are pushed out through the fibrotic marrow.